Okay, so my name is Philip Wu, and I led one of the sandpit projects entitled Misinformation Intervention and Countermeasure for Health Advice, or MICHA. So today I'm going to share with you what we did in 6 months' time and what our preliminary findings and maybe some personal reflections. So I think we have seen many evidences of bad boards, malicious boards that spread misinformation online. I think we're very much aware of the risk of living in an inauthentic world, but I think at the same time we should not forget that boards can also do good. Yeah, so I guess that's kind of one of the long-term ambitions that we have is to look at something called benevolent boards to explore the inauthenticity for the greater good. So our aim is to develop a AI agent that can monitor and count health misinformation on social media through realistic and human-like interaction with users. Okay, so that's our long-term ambition, and I'll of course shortly talk about what we actually did for this 6 months. I think using AI for content moderation is not new at all. So more recently, I think one of the Reddit co-founders said that AI should be moderating all social media social media forums and spaces. And we all know that Reddit has a large army of human moderators, and it won't be a surprise to us that this human moderation is one of the first jobs to go in this age of generative AI. And not only just for content moderation, I think AI now has been employed across many different online forums and spaces to interact with users as well. For example, on this Twitch channel, it has become fully automated with commentary, done entirely by AI. Okay, so technically speaking, I don't think there's any major obstacles to design a chatbot or a bot to monitor the misinformation online and interact with users. But I think before we jump into the design of such a bots, I think one of the questions we have to explore first is how do users of these online forums and communities perceive such a bots? Right? To what extent do they accept the idea of interacting with bots instead of human beings on these forums? And will that actually change the community dynamics and how they feel about the forums and the communities? Right. So with that in mind, we want to address this very specific research question in this project. That is, what are the user perceptions and design considerations for a conversational AI agent that can interact with users in maternal health online forums to counter misinformation? Now, the reason we focus on maternal health, it's partly because some of my team members are young parents who experienced the misinformation on these maternal forums firsthand. And secondly, we think that maternal health gives us a very sharp focus on the problem. Okay, and we, with this very specific research question in mind, we designed a set of research activities, which I'll go through very quickly. So we did a systematic literature review using PubMed and Scopus, and we also did a quick and dirty landscape analysis to see what's out there in terms of the technologies and the countermeasures which are being used by industry and organizations. And we also did an online survey and followed by 2 online focus groups. So with the literature review, with such 2 databases, PubMed and Scopus, we focused on empirical studies of using AI and machine learning to combat health misinformation. And we only looked at the journal articles because, as you probably can imagine, the literature is so vast if we include the conference papers. And in the end, we ended up with 93 articles that met our criteria. We did the coding, and we did some content analysis as well. So because of limited time that we have today, so I'm just going to highlight some high-level findings from literature review. So we found that literature focused on health misinformation detection methods, okay, such as fact-checking and labeling. Okay? Only 6 articles explored AI chatbots or any kind of in-context interaction using AI, do some kind of social correction. So in other words, most research focused on how to detect and label out those misinformation posts, with very few studies focused on how to actually counter, this kind of misinformation posts through social interaction. And when the misinformation countermeasures,
so we can get you to the right place. Please.
I'm hearing another sound. Okay. So misinformation countermeasures, when they were employed or designed, they were rarely evaluated for user perception and acceptance. So in a way, I think our literature review demonstrates that there are gaps in the literature that this research can potentially address. So for the empirical studies we have done, for the online survey, we sampled people from Prolific. We looked at, we selected people who were pregnant, or their partners were pregnant at the time, living in the UK. And as I said before, with such a very specific focus, our population is actually not that large. Okay, so for example, there are only total over 1,000 people eligible to participate in the study on Prolific, and we did a lot of quality check. Okay, because as we know, there can be some dubious answers from this kind of online survey platforms. We did a lot of quality check, and in the end, we accepted 234 respondents. So this is the N. Okay. Some quick demographics. As you can see, the majority, actually, about 3/4 of respondents had undergraduate degree or above. 5% even had a doctorate. So it's a very well-educated population or sample. And the age is mid-30s, which is not surprising at all. Yeah, so that's the right range that of the people we're looking at. Those people that do visit parental support and maternal health forums quite frequently, and more importantly, I think they not only visit these forums to search for information or to browse, they also apply the advice information they get from these forums to support their own health. In fact, about 35% of people saying that they often use or always use advice they get from the forums for their maternal health support and parental support. And one of the key questions we asked the respondents was that, how much of the health information encounter in this online spaces you think is false or misleading. So in other words, we're asking what their perceived amount of misinformation on these forums. I think the results is slightly surprising because the most people, more than 50% said there was only a little misinformation. 3% even said none, and only 8% said there was a lot. Okay, so in other words, it seems to us that there's a very high level of trust towards the health information posted on these online forums, and in the survey because it's online, so we described the initial thinking of how to design such a misinformation countering AI bots. How do we envision the Benevolent bots would interact with users in these kind of forums? Then we ask people, what do you think? Do you think these kind of AI bots would be useful and helpful? And as you can see, the majority of them think that such a boards would be helpful in terms of improving the content of the online forums, in terms of help others on these forums, in terms of be directly relevant to them and be useful to them. Okay, so to kind of sum up of the survey findings, by the way, there are many details that I, again, don't have the time to share, but again, on a very high level, we found that the respondents showed a high level of trust in maternal health information shared in online forums. There's a slight nuance here, which shows that education level has a positive association with perceived amount of misinformation. So, which means that the higher education level, the more perceived misinformation. Okay? And then also respondents showed a high level of trust in the ability of Benevolent board to provide accurate information and to improve the online space. The little caveat here is that the age had a negative association with trust, which means that as people get older, they become more cynical. Yeah, so that as less trust to these kind of AI bots. So that's again very briefly, very quickly, our online survey results, and then we followed up with the 2 online focus groups. We had 2 focus groups, and the first group, we had 4 people. These 4 people were recruited from the online survey respondents, okay, as a follow-up, because in online survey asked, toward end of the survey, asked whether they want to participate in the next step of the study. Some people replied, and then we recruit 4 people from them. The second one, which consists of 6 people, we mainly recruited from our own networks. I mean, to me, I think the most interesting findings actually were from the focus group discussions. Okay, so it seems that the people don't really mind the presence of AI bots in online forums. Remember that one of the first questions we had in the beginning is that would actually having AI bots in these online spaces would change the perception and the community dynamics. It looks like it's people don't really care about that, because Instagram is full of bots and people still use it the same as ever, right? By the way, in case it's not clear, the quotes here are all extracted from the focus group discussions. And human interactions are not necessarily authentic, right? So we're talking about authenticity, but our respondents say that people would troll, right? So many stories are simply just plain made up in these forums anyway. So human beings are not necessarily authentic anyway. And AI should not be used to block or remove all the misinformation posts. They believe that some misinformation posts should be just enlated post out there and serve as educational purpose, when flagged or debunked. So in other words, the behind the scene kind of blocking the misinformation post may be not the best approach. And online forums not just for factually accurate information, because sometimes people go to these forums not only to seek accurate information, but also just to feel connected with other people, to have some fun, right? So maybe sometimes people say, I want to read some nonsense, yeah. And the trust depends on the information sources. One person said, put it very accurately, AI is only as good as the information it's receiving. Okay. And finally, I think this is a very intriguing finding. Misinformation is a socio-technical problem, and our respondents say that whatever technology design, whatever solution you come up with, it's never going to stop misinformation if people are working within a bubble, right? So in other words, aside from thinking about designing effective and efficient technology solution to misinformation problem, we also should think about more broadly, what exactly we're dealing with here. Okay.
You have 1 minute, Philip.
Yes, that's the summary. Summary implications. So, well, I guess this is maybe a bit of exaggeration. So authenticity maybe is overrated. Okay, people, again, as I said, don't really mind about inauthenticity in a way. Contextualized social correction works better than behind the scene black box information filtering. And trust depends on information sources. And finally, again, this is the question that I've been thinking, over and over again. So are we really developing a technology solution to a social problem? Okay. We don't have an answer, but I think it is a very, very intriguing question we can explore further. Okay, so I think my time's up. And finally, so this is the team. And I don't know how many of them they are actually here, but it was being a great pleasure to work with them all. So thank you all. That's all.